Welcome to our presentation on the value of post-professional residency, fellowship, and PhD training. My name is Jennifer Stevens-Lapsley, and I have a PhD in a rehabilitation science field. Michael Botti also has a PhD and experience with fellowship training and will be joining me to talk about the residency and fellowship aspects of this presentation. The objectives of this presentation are to describe the differences between residency, fellowship, and PhD programs, as well as to describe the advantages of post-professional training and strategies to find the right program and mentor. We also hope to describe the considerations that will make your application more competitive. So how do residency and fellowship programs differ from PhD training? Well, Mike will go into this in more detail, but residency and fellowship programs allow for greater clinical expertise and specialization. And PhD programs allow for rigorous training and clinical research designed to advance clinical practice in the PT profession. So you really have to ask yourself, what are your goals? Are your goals residency, fellowship kind of based, and your direction is to be more involved in management or clinical roles? Do you want to be a clinical expert and really specialize? Are you interested in contributing to the evidence that's available on a level of case studies on individual patients? Or are you interested in being a professor or a clinical instructor in academia that has the opportunity to change and advance clinical practice on a much larger scale while sacrificing that individual kind of one-on-one day-to-day patient interaction? And are you interested in conducting large-scale funded clinical research on population and health systems levels? When I mention getting a PhD to individuals, there are a number of considerations and concerns that are voiced. One of those is financial. Many individuals understandably don't want to incur additional debt by going back to school and getting a PhD. So I'm going to talk about this in a little bit in more detail. The other consideration is fatigue from just being in school for so many years, and that is certainly a very important consideration. And taking a break between DPT education and PhD program training is often a way to balance and kind of get a little bit more of a distance from being in the classroom for such an extended period of time. That being said, I'll talk a little bit more about things to look for in PhD programs, and if looking for a program that really has a shorter duration classroom component could be the solution to minimizing some of the classroom kind of fatigue. For example, our rehab sciences program at the University of Colorado, most students really only have a year and a half of coursework, and then the remainder of the time is spent in very practical applied learning settings. Another consideration is that students want to specialize and get really hands-on experience early after graduating. And that's an important factor in your decision as to when to go back to get a PhD or whether to go back to get a PhD. But you can certainly find ways in which to integrate clinical practice with the PhD training such that you're still interacting with patients. Many of the students that work with me during their PhD training lead clinical studies where they're working side by side with therapists in the community, or they're treating patients themselves one-on-one. And then, of course, people certainly strive for balance in their lives, and it is possible to have balance while getting a PhD. I think one of the things that I love most about my job is that work doesn't feel like work. Much of the time I'm enjoying my responsibilities and opportunities so much that that inherently creates a little bit more balance and allows me to really truly engage in what I'm doing in a meaningful way. So an important question is whether or not there's a need for additional physical therapy faculty. And the answer is yes. One of the APTA documents that describes the current number of students or the historical number of students compared to the projected number of students in classes throughout the country indicates that this number is increasing over time. So we will indeed need additional faculty to instruct in programs across the country. This is an important consideration because that's not true for all PhD trainees. Other disciplines, the job market is much more competitive, but we're fortunate to be in a field where the job market is wide open and there is a lack of really talented and adequately trained research physical therapists, and they currently 47% of faculty have PhDs in physical therapy programs. And this number is expected to increase as CAPTE institutes additional requirements for the number of PhD or equivalently trained faculty in DPT programs. So what does a professor do? Well, there are many different combinations of responsibilities that make this job so rewarding. And every individual wears a different hat with different proportions of each of these elements. Some of us are involved in research as our primary responsibility. Many of us are involved in teaching as our primary responsibility, along with clinical and service activities. And service is one of the critical foundational pillars of academia, where everyone is expected to provide service to the clinical community and the profession as a whole. The other pillars can be interchanged in different proportions and combinations depending on your interests, your background, and your goals. So there's a lot of opportunities to continue to grow and change and discover new areas of opportunity in academic settings. So I spoke briefly about the financial considerations, and one of the first things that most people indicate to me is that they really don't want to incur additional debt, and that's very understandable. Most programs do pay students a stipend to undergo or to participate in PhD training. And this stipend can range from $23,000 to $27,000 or $28,000, $29,000 per year, depending on the program, as well as most programs will pay your tuition, and especially these are really for full-time PhD students, as well as health insurance. If you choose to go on to receive additional training, which is not necessary, but is an option for many individuals who really do want to pursue a career in research, 2 additional years of postdoctoral training result in a slightly higher stipend plus health insurance. And when you compare that to the average PT starting salary, in years 0 to 3 and years 4 to 6, I'm going to present kind of some information that Daniel Pinto presented at CSM, a version of this. He did a wonderful job of breaking things down and looking at the cost benefit and how long it takes to kind of pay off the deferred earnings that's part of getting a PhD. So if we really look at $200,000 in lost earnings with the combination of a 4-year PhD and 2 years of postdoc training, this can be attenuated by additional scholarships that many students are successful at getting. For example, our rehab science program, we have a really strong track record of individuals getting foundation scholarships. And so this can amount to up to $50,000 in additional income, as well as additional scholarships from APTA sections, National Institutes of Health, or other sources. But the big one is loan repayment grants. You can have all of your federal student debt paid off, whatever the amount is. We've put here an example of $100,000, but with proper training and a competitive application, it is very possible to have your loans paid off in full. And so when you consider these factors, the net lost earnings amount to less than $50,000 a year, $50,000 total. And so then when you look at clinician salaries, and I'm pointing to the kind of 16-year time frame as the long-term outcome versus a professor in the same kind of time frame, you see that there's about a $20,000 differential in salaries. That is actually present early in the initial years as well, so $65,000 versus $86,000. So over time, that certainly adds up. Over a 30-year period of time in a career in academia versus clinical setting, that's $600,000, which equates to about $1 million in differential when you compound interest, etc. And this number of CAPTE faculty salaries may actually be a little bit lower than what would be expected for PhD trained faculty, especially those with a research emphasis. So this number represents what CAPTE program directors, what's recorded in terms of CAPD program director salaries, and that may be closer to the true salary ranges for individuals with a heavy emphasis in research and who are successful at getting funding. So there's a pretty big differential, and of course there are other opportunities as faculty, including consulting opportunities, patents and royalties, paid travel opportunities, paid editorial board memberships, paid continuing ed teaching opportunities. And so those are additional ways in which to narrow that gap. Daniel Pinto ran the numbers with the loan repayment grant option and found that within a year or two of finishing your PhD and postdoctoral training, you've already broken even. And then you continue to increase in terms of earning potential compared to clinician salaries. But certainly, finances are not the only thing that should be considered when making a decision. The reason I present the financial information is merely to illustrate that the finances shouldn't prevent someone from getting a PhD. More importantly, an emphasis on the other meaningful aspects of having a PhD are presented here, including the tremendous impact on advancing and sustaining our profession. That's done through research, through teaching. There's just such a wonderful opportunity to truly mold the future of the profession by having a PhD. There's an intellectual stretching and challenge that I love and enjoy with everything that I do. In other words, there's never a dull moment. There's always new growth opportunities and really wonderful ways in which I can continue to develop new skills and stimulate my mind and concurrently be contributing to our profession. One of the things that's often highlighted is the tremendous flexibility that comes with having a PhD and working in an academic setting. So I can take off 3 o'clock in the afternoon and go watch my kids' soccer practice, and then maybe I'm back working on my computer after they go to bed. But I really have the flexibility to make my schedule work for me. I can decide next week I want to take a day off without having to cancel patients on my existing schedule, or stay home for the furnace to be fixed, or whatever it is that's unexpected, and be able to accommodate. The other one that I value tremendously is the sense of professional connectedness that comes with being in academia. It's a small world, and you really start to get to know some of the key players and develop really strong relationships that really help foster an increased enthusiasm for the work that we collectively do. There are also travel and professional networking opportunities that are rewarding. And one of my favorites is mentoring the next generation of physical therapists. So really having the opportunity to educate students in the classroom setting, as well as PhD students and other professionals, and really truly having my hands on influencing that next generation. So what are the characteristics of successful PhD candidates? Well, perseverance and tenacity are really important. There's often uncertainty, there may be rejection, face of frustration. You have to be willing to keep moving forward. There are tons of rewards, but there are also obstacles, and you have to be willing to kind of push through those. Cogency is another important characteristic. A good PhD student must have the ability to clearly articulate their ideas in person and in writing. And then self-discipline, so setting priorities and optimizing time management are important. You're not given a structured schedule. You have to kind of create your own schedule and your own time frame for finishing tasks throughout your PhD training. If you want a list of all the PhD programs throughout the country, there's a wonderful website through the APTA that lists every program. One program certainly that I am most familiar with is the Rehab Science PhD program here at the University of Colorado. And in fact, if you are in the area and are listening to this before September 20th, we have an open house that we have planned to give people more exposure to what PhD training would look like in our environment. So feel free to RSVP or contact Kenton, whose information is listed here below, regarding this opportunity. We would love to have you join us and answer any additional questions that you might have. So what should you look for in a PhD program? The research areas should definitely match your interests. However, the research process may be more important than the specifics of what your mentor is researching. In other words, you have to have a match of some sort, but it doesn't have to be a perfect match. The purpose of the training is to develop skills in how to go about the processes of conducting research that you can then apply to any patient population down the road. So identifying a good mentor that has an environment in which you can learn and grow is far more important than the specific line of research they might be conducting and the specific population of patients they might be working with. Another consideration is to avoid programs with excessive coursework. What do I mean by that? Well, our program in the University of Colorado has 30 credit hours of coursework with 30 additional credit hours of dissertation work, which is applied and hands-on. And so that's far less than many programs and allows the student to really focus on the applied hands-on training as opposed to a ton of classroom training. Many students, especially coming out of a DPT, are tired of just coursework in a formal didactic manner and really want more of a hands-on approach. It's also important to look for a program with a history of students getting funded. Look to see whether students have Foundation for Physical Therapy funding or section awards or awards from the National Institutes of Health. And look for a program at an institution that is large enough to support a variety of collaborations. For example, I have a student who came in being interested in muscle physiology but has expanded her research interests to focus more on implementation dissemination science. Very different areas, but being in an institution and a lab environment where there's room for growth helps allow the students to adapt and grow throughout the training experience and consider new opportunities and new training experiences. So what should you look for in a PhD program when you're looking at full-time versus part-time? A full-time program is going to allow you to finish quite a bit sooner in most cases. It's also going to allow you for paid tuition and health insurance. And really the key that I emphasize is that you can very often generate more productivity in terms of publications and grants, and that makes you more competitive for scholarships and loan repayment grant funding. At the end of the day, one of the reasons why people don't want to go full-time and they go part-time is the financial piece. But I've explained in detail why that piece may not be as big of a barrier, and maybe getting a full-time PhD and investing yourself is really worth it for the payoff in the long run. But a part-time PhD does allow you to work clinically while completing your PhD, and for some people that is the right choice. It does require, in most cases, that your tuition may be unpaid and your health insurance benefits may not be provided through the program, but maybe they're provided through your employer. What to look for in a PhD mentor? Well, the mentoring experience is a really important part of the process, and so making sure that you have a mentor that's really invested in creating a good learning experience is essential. The productivity of the mentor is also really important, so look at their publication record. What their publication record is likely to translate into what your future productivity is going to look like. The mentor's grant funding is an important piece. Are you going to have the resources you want in order to ask the questions that you want to ask? And are you going to have the resources to go to conferences and network with people? And then the track record of getting PhD students funded, again, is very important. So if the students are getting funded, in many cases our students are able to get funded and add to their base stipend that we provide. And that track record of past students getting funded is an indication of opportunities for you as a future student to also be funded similarly. Make sure your mentoring style matches, the person's mentoring style matches your work and learning styles. So if you're really want a hands-on experience versus a hands-off experience, that you really explore that carefully to make sure it's a good match. And check to see that the history of graduates getting desired jobs upon graduation is there, because that's an important part of, again, your future opportunities. So what's the best way to prepare for PhD program training? One of the important factors that we encourage everyone to consider is getting involved in some aspect of research just to test the waters. See if it's for you. See if it's something that engages you. If you're passionate about asking questions and you're curious, this is a way to really kind of test the waters and see if this is the right road for you. Visit the research labs, talk with the mentors, talk with the mentees. Make sure you get a feel for what that environment is like and what the pros and the cons are from the students' perspectives as well as the mentors' perspectives. So hopefully I've touched on some of the key considerations that you might be considering if you are interested in getting PhD training. The financial piece in terms of not hopefully not being a barrier. The school fatigue, my recommendation is certainly take a year or two off after you finish your DPT training, but don't take 10 years off if you can avoid it, simply because if you do have loans, why not go back and have those loans repaid while they're still in existence and get the best of both worlds. I also think that you really can incorporate clinical practice into clinical research and PhD training, and so that shouldn't necessarily be a barrier. And balance is possible with PhD training. Most of our students state that they're passionate about what they do, they love what they do, and it doesn't, again, like I said earlier, it doesn't feel quite as much like work. It feels more like they're really contributing to their future growth and opportunities for further advancement down the road. It's an incredibly rewarding opportunity to be in an academic setting. There are so many wonderful challenges, wonderful opportunities, tremendous colleagues, growth opportunities that are endless.
Hello, my name is Michael Body, and it's my pleasure today to talk to you about residency and fellowship training. My background is that I am the past director of the Regis University Orthopedic Manual Fellowship Program. As well as myself, I did complete my fellowship in orthopedic manual physical therapy through Duke University. I was the first fellow through that program and helped to design that overall program. I've also had numerous experiences designing orthopedic residencies and collaborate with numerous residency and fellowship directors from around the country in all different types of residency and fellowship training as a result of some of the roles I've had in the past. And so it's my pleasure today to talk to you in contrast to what Jen talked to you about. Instead of PhD training, I'll be talking about residency and fellowship training and the benefits, as well as types of programs and how to apply and make yourself more competitive for those programs. So before we dive in, it's just important that we're on the same page in terms of overall terminology. There's several different types of clinical education programs. The most common, the ones people are all familiar with, are clinical internships, and these are the types of clinical education experiences that you go through for your entry-level physical therapy program. This is in contrast to residency and fellowship programs. It's important to realize that these are post-professional degree programs. So these are only for after you have received your doctorate in physical therapy and you're a licensed physical therapist. And it allows for greater specialization, whereas DPT training is for generalist education. So clinical residencies, these are formal programs, at least 1,500 hours in length. They involve both didactic and mentoring components. And those mentoring components are one-on-one mentoring by experts and specialists in that area. So for example, if you're going through an orthopedic residency, you'd be receiving your mentoring by individuals who are OCS certified in that area. These are in defined areas of clinical practice, and we'll be talking about those areas in the future. And they're really designed to take an individual from a generalist level practitioner to a specialist level in that designated area. They range from 9 to 36 months in length. Average is about 12 to 18 months for full-time programs, and then part-time programs can range up to the maximum of 36 months in length. Clinical fellowships, these are also formal programs of at least 1,000 hours of education. They also involve didactic and mentoring components. Key delineation here is that your mentoring would occur with experts, specialists, and subspecialists, because this clinical fellowships are a subspecialization within an overall category. For as an example, orthopedic manual physical therapy follows under orthopedics, so it's already been determined that you're a specialist within orthopedics. Now you're refining your skills in orthopedics in a very subspecialized area. Another example might be the upper extremity athlete, for those individuals who are already specialists in the field of sports. You'd be doing your mentoring within these fellowship programs with people who are already subspecialists within that area. They're defined area of advanced clinical practice. We'll talk about those in the future. And they're really taking you from a specialist to subspecialist level. They're the same kind of overall length as residency programs, ranging from 6 to 36 months in length, with the average being 12 for full-time and 36 for part-time options. So as you can see, there's several similarities between residencies and fellowship programs. They both have didactic and mentoring components embedded within those formal programs. And they're both designed to advance clinical reasoning and expertise within a focused area of practice. The differences, hopefully you've picked up on this, is really specialization versus subspecialization. And they have defined content areas. DSP stands for Description of Specialty Practice, and DASP is Description of Advanced Specialty Practice. And both residencies and fellowship programs have these defined content areas designed during their establishment. Also, residency training prepares you for specialist certification within your area that you're studying, whereas fellowship training typically does not have a culminating certification with it, with the exception being of orthopedic manual physical therapy, and those individuals would be eligible to become fellows of the American Academy of Orthopedic Manual Physical Therapy. Requirements for admission to these programs are the same between residency and fellowship. However, for fellowship, you need to already be board certified or post-residency, or at least demonstrated expertise in that clinical area, and this is often defined as 1 to 2 years of full-time practice within that specialist area. Programs have differing requirements for admission into fellowship programs, so it's important to note that as a new graduate of a physical therapy program, you're not eligible to apply for fellowship training. However, you are eligible to apply for residency programs. There are numerous benefits to undergoing residency and fellowship training. Hands down, I think mentorship to me is the most important aspect of these programs, followed by the structured curriculum. As well as there's numerous other benefits and reasons one might undergo residency and fellowship training, and we're going to talk through those in detail moving forwards. The first is mentorship. As you're aware that both residency and fellowship programs have a mentored component. This mentoring occurs in a one-on-one clinical setting, and it's during the patient care process typically. That's where a bulk of your mentoring occurs. So you're going to be working with a mentor side by side who's an expert in this area, or a subspecialist, and you're going to be seeing your hardest patients or some of their most challenging patients. You're going to be problem solving and learning how to really advance your clinical skills. But mentorship doesn't really just stop there. It also expands to numerous other areas surrounding professional practice in physical therapy, such as leadership, professionalism, ethical and moral issues, consulting, research, teaching and educating, your clinical reasoning models, and interprofessional and team-based care. And so it's really not just solely focused just on the patient, but really on the broader professional aspects of being a physical therapist. In addition to structured mentorship, another huge advantage of residency and fellowship training is that they have a planned curriculum. This curriculum is designed around the description of specialty practice or advanced specialty practice, but I will say curriculums have a large amount of variability on how they're implemented, and so this is one of the key aspects when I'm looking at a program. I really want to learn more about how their curriculum is designed and structured, because it's just like physical therapy programs. While we all have a accrediting body and certain standards we need to meet in terms of what we teach, we have a lot of leeway into the breadth and depth that we cover that information, and so there's a lot of diversity in how curriculums are manifest in different programs. As well as I want to call attention to something that many of you may or may not be aware of, and that is that often many of these residencies and fellowship programs have defined diagnostic groups or categories that you need to see as a part of that training experience. So this is in direct contrast to your clinical internship experiences, where really you see patients, just whoever's walking in the door. Here with residency and fellowship training, you're prescribed that you need to see X% of patients in certain key content areas. I put up the orthopedic one here as an example. You can see that 3% of your patients need to be in the head, maxillofacial, craniomandibular area. You also see at 4% in wrist hand. I know there's numerous practice areas where you may never see patients in these categories, and so this is a defining characteristic of residency and fellowship training, that you have certain diagnostic groups and categories that need to be met, which I think adds to a richness of that experience because you're ensured of seeing those patient populations. Oftentimes programs are structured such that you're studying, let's say, temporomandibular joint. You're being mentored by an individual who's an expert in that area, and you're seeing patients in that area simultaneously. And so it's a very rich and powerful learning experience overall. As an example of how that curriculum might manifest along with the mentorship, I posted here the Boston University Neurologic Physical Therapy Residency Program, a typical week schedule for their residents. And you can see that it's a very diverse schedule. And so you'll have clinical practice typically in many residency programs here, as well as fellowship. You'll be practicing 32 hours a week, so kind of a 3/4 load for a physical therapist. But then surrounding that, you'll also have additional opportunities. So you'll have your defined clinical mentorship. Typically, I've had blocks in the past where you're scheduling in your patients and your mentors scheduling patients into those blocks for those defined mentorship areas. But you also have other opportunities such as grand rounds or rounding with other interprofessional teams, specialty clinics. Many, especially academic programs, have teaching components to them. As well as research components to them. But I should mention that all residencies and fellowships do have required research components to them, but typically at the case study level, and that's a big contrast to PhD training where these can be up to large-scale clinical trials, and so a little bit different research component typically. You also have time periods where you're working on your webinars or didactic components. You may be flying to different locations. Here in the example, you see Saturday, Sunday. This program uses the Neuro Consortium educational curricula, and so this individual will be flying into LA to receive part of their didactic training at that site. So overall, a very diverse weekly schedule designed to really elevate someone to a specialist within that area. So we've talked about the mentoring and curricular components, which are by far the biggest advantage of going through these programs, but there's numerous other reasons you might be choosing to go into these programs. The first is, of course, well, I want to be a better physical therapist. I want my patients to do better. And so the question is, does residency and fellowship training improve those outcomes? We're really just beginning to get information on this. The first study of its kind was published last year by Rodriguero and colleagues in 2015. And they examined photo outcomes from individuals who had gone through residency or fellowship training, as well as who had not gone through either program. And what they found is that fellowship trained PTs had significantly better outcomes than PTs with residency training or no formal post-professional education. In contrast, residents did not have superior outcomes. However, the comparison might not have been a perfect one within the study in the fact that residents were typically younger as well as less experienced in the comparison group. So it's hard to really draw any firm conclusions on that with those factors in play. So potentially it could improve outcomes utilizing self-report outcome measures such as photo. What we do know is that when we talk to graduates of these programs, they really perceive a very strong benefit of these programs to improve really their patient care aspects. So you can see here highlighted in the top red box, major positive impacts on their ability to perform thorough clinic examination, clinical reasoning, to treat efficient, effective, to diagnose, and to treat complex patients. Huge majority of respondents really indicating that this had a big impact on their ability to do those. You also see in the bottom a number of people had said that it really improved their career interest and fulfillment. And I really think that comes from the structure of these programs and the individuals you work with. Oftentimes, people who are involved in residency and fellowship training are incredibly passionate about the profession and patient care. And I think that passion is contagious and it really helps to improve your career interest and fulfillment. You'll also see there's numerous other areas that people felt there was positive impacts, such as their ability to communicate, potentially patient referrals, salary promotion, job opportunities, and leadership roles. And we'll talk a little bit more about that here in a second. So there was a survey by Jones and colleagues in 2008 looking at residency trained versus non-residency trained orthopedic PTs and the likelihood of certain attributes being found in individuals who had gone through residencies compared to those who had not. And what they found is that those individuals who had gone through residencies were much more likely to participate in fellowship programs, much more likely to go on to be board certified. to serve as a clinical instructor, as well as being involved in education. Numerous of those individuals were participating as an instructor in a physical therapy program, coordinating a course in a PT program, or serving as faculty in residency and fellowship programs. And so if those are career goals of yours, residency and fellowship training does appear that it helps to open up some of those doors for you. I will say that not as much as PhD training. I think PhD training really opens up quite a few more doors for you in terms of your ability to participate in academics. However, if you're interested in being a lab instructor or kind of getting your feet wet within academia, I think going through these programs is an excellent way to try and cultivate those opportunities, especially if you're going through a program that has a PT program associated with it overall. We know that going through a residency program does help to improve your first-time pass rate for your board certification. And so I think that's due to the benefit that you're going through a structured curriculum designed around really enhancing knowledge that you're tested on during these board certification exams. You can see that in 2015, 94% of residency graduates passed first time compared to people who had not gone through a residency. That was at 74%. And so you can see an improved ability to pass your board certification exam. A big question I get asked often is, well, will I get paid more for going through this? There's some evidence that suggests maybe. In Jones 2008, and so that was the survey I referenced earlier, and this was not the main intent of the survey to establish this, but they did look at this question, and these individuals had fairly similar years of experience, and they found that residents had, on average, they made about $6,000 more than non-residents. However, they did note that there were some imbalances in those groups, and you can see that it's a really small sample size, and so I think we're really limited in the conclusions we can draw there. In that Smith 1999 study I've already referenced, a majority of residents perceive positive effects on promotion, salary, and job opportunities. But again, we need a little bit more data on this to firmly suggest that. I will say that you'll definitely gain experience within that specialist area, and this may improve your marketability. Some areas such as orthopedics, sports, pediatrics, these are more challenging areas to get good jobs in. And so by going through these programs, you gain experience in these areas. I can say in the Denver area, I see numerous job advertisements in orthopedics that ask for 1 to 2 years of orthopedic experience. That can be a big barrier for the new grad who just doesn't have anything beyond clinical internships in that area to gain employment in the area that they really want to work in and are passionate in. So this can be a good stepping stone for you. So we've talked through all the different benefits of residency and fellowship training, and now I want to turn to kind of more program logistics and what programs exist and how you might choose a program. So here we have about 219 programs in residencies, and you can see they span numerous topic areas. So acute care, cardiopulm, clinical electrophys, geriatrics, neuro, ortho, ped, sports, women's health, and wound care management. By far and away, orthopedics has the most residency programs, followed by neurology and sports. In terms of fellowship programs, there's 42 programs currently in the content areas of critical care, hand therapy, manual therapy, movement system, neonatology, spine, sports division 1, the upper extremity athlete, and educational leadership. By far and away, the manual therapy programs dominate this category with 26 total programs, and these are some of the oldest programs in the country. So Kaiser Hayward, their manual therapy fellowship program has been around since the late 70s at this time point. I did want to call attention to the growth of residency and fellowship programs. Really, growth you can see over time here has been fairly exponential in terms of the number of residency and fellowship programs available. Currently, we have nowhere near the capacity that we need in order to have physical therapists go through residency and fellowship training as a formal part of their education. We just don't have that capacity currently. And so there's high competition for residency and fellowship training. But depending upon when you're going to be entering into residency and fellowship training, there may be quite a few more programs given the overall expanded growth of these programs over time. So when considering which residency program or fellowship program you want to go into, I think there's a lot of things to think about. The first and foremost is this really the right choice for you? Dr. Stevens Lapsley spoke about your goals. What are your overall goals? So you have to really determine if this is the right option for you, just from your overall professional goals, but then also, is this the right time in life? Oftentimes you might have to move, relocate, there's salary considerations, there's a lot of other considerations that really go into this decision of if residency or fellowship training is the right decision for you at this time point. And we're going to talk through some of the big ones surrounding this. So the first is costs. This is a very large generalization, but there are basically two models of costs. There's a reduced salary model, so residents will typically earn a 3/4 salary, and that's just based upon the fact that they're only seeing a 3/4 patient load because their other time is spent either in mentoring or other didactic components, other learning opportunities, and since our salaries are so heavily reimbursement driven, that this is why it manifests that you have a reduced salary because you're only bringing X amount of money. There's also a tuition-based model where you might be earning a full salary or even a reduced salary, and then you pay tuition on top of this for the didactic proportion. For example, Evidence in Motion's orthopedic residency program, that tuition is about a little over $12,000. I have seen quite a few employers cover that as part of their continuing education benefit for individuals interested in residency or fellowship training. So that's something to talk about to your employer with if they currently don't have a residency or fellowship program and you are interested in doing more of a hybrid online model such as EIM. It's also important to note that you can defer your loans while you're in residency and fellowship training, just like PhD training. But I carefully consider if this is really the best option for you. It might make more sense for you to continue paying your loans, especially if you're in an income-based repayment program and you're making payments towards your public service loan forgiveness. And so you have to consider if that's the best option for you economically. There's also some benefits in terms of post-professional student membership discounts. This applies for PhD students as well. And you get half off your APTA dues and conference attendance, which I think is nice and can help reduce some of the financial burden of participating in these programs. Questions to ask your program. Some key areas are benefits, as you'll see that some programs really truncate their benefits for their residents or fellows, and so you want to be aware of that. You might not have a full benefit package that's typically found for those employees. Professional dues, some programs will require you to be APTA members or members of different professional societies, and are those covered or not included? Those are things you want to know, as well as are there additional continuing ed costs or curricular costs, as well as travel costs associated with receiving that education. These are all considerations that you want to talk to the program director about. Probably the biggest one is location. You can see here, this is a map of the credential residency and fellowship training programs in 2013. And you can see definite parts of the country where there are numerous residency and fellowship training programs, but then there's large swaths of the country where none exist at all. And many programs are going to require you to relocate to that area if you don't already have residency and fellowship programs in your specialist or subspecialist area that are found in your local area. And so is it the right time of your life to move for this training experience? And that's something you'll have to ask yourself and weigh in your overall life context. So in addition to cost and location, program model to me is a big decision because it really interlaces with your overall goals, what you're hoping to get out of your residency or fellowship program. And there are several key types of program models. And I'd say that there are also numerous hybrids of these. So by far, there's not just three. There's a lot of blending between these. But I think it's good to kind of think about the basic concepts surrounding these constructs. So the first would be an academic program model. And this might be like our University of Colorado, our pediatric residency program. So these are residency or fellowship programs that are housed within a major academic institution that also has a physical therapy education program associated with it. These are often considered to be the gold standard for residency and fellowship training. And the reason being is that the people who are doing the mentoring as well as designing and implementing the curriculum are often national leaders within that specialty or subspecialty area. And so you have great mentorship and didactics within those programs. You also have outstanding teaching and research opportunities. And so if you're interested in opening up some career pathways into teaching, these are the types of programs I'd be targeting because you're most likely to build teaching experience within these programs. It's also that loan deferment is a little bit easier within these programs. Cons are location constraints. If you don't have one of these programs in your local area, you will need to move. And I would say that these are hands down the most competitive programs. Our next type of model would be more of a clinic or hospital-based program model. And so this could just be a private practice that has several specialists or subspecialists working for that private practice. And then they build a curriculum for their resident or fellow and implement their residency or fellowship. And so as well as it could be a very large hospital system that's doing this as well too. Like Duke University Medical Center in collaboration with Duke University. And so this is a large medical center that has numerous residency and fellowship opportunities within it. And so I'd say that the range of programs within this category is very, very large. So you could be from just a single clinic all the way up to a multi-clinic system. And so you can be of very high quality. They can have many resources, many research opportunities, and they may pay for their employees to undergo training. However, I would say that it's very variable, and so you have to evaluate each of these programs carefully in terms of what they're offering. There's also location constraints with these programs. The curriculum can be a con in some of these, in the fact that they might be outsourcing their curriculum to a provider like MedBridge, which isn't necessarily a con because those resources are becoming better and better, but it's just that the curriculum isn't really as sometimes as fully integrated within the program as it can be in other residency or fellowship training experiences. These can be very competitive as well. The final one is the hybrid online model. So this would be like Evidence in Motion or several other orthopedic manual physical therapy programs, like the one I was past director of, Regis University. Some pros of these type of programs are there's no need to relocate. So you're able to practice locally where you live, and then typically you're doing your coursework online in the evenings and weekends, and then several weekends of the year you'd be flying into locations to do in-person training in terms of your psychomotor skills, as well as maybe advance your clinical reasoning and assess your overall clinical skills in that area. And so there's some great advantages to that, including the lack of need to relocate. Typically, curriculum is really strong within these programs, and they contain a very large cohort of individuals. So if you like learning with large groups, like maybe your Doctor of Physical Therapy program, this could be a very good program fit for you if that's your learning style. And then I have seen numerous employers cover these types of programs for their employees. The big con of these programs is you need to find your mentors. Oftentimes these organizations have resources for you to assist in this, such as their graduate network. And so that is not as large of a barrier, but I have worked with numerous fellows in the past who've had a hard time finding anyone locally, and that has necessitated them to fly to different locations to do their mentored experience, which is a little bit less ideal. I think the ideal for mentorship would be a regular mentored experience, like on a week-to-week basis, as opposed to just kind of a little bit more sporadically. But I think overall we need to balance what's realistic for our life. These can be very great programs, and their graduates can be just as good as these other programs. And so you need to consider which types of those models really works best for you. Next thing to really consider in your program is the mentorship and curriculum. I'm not going to spend too much on this, but so you really want to learn about what aspects define their curriculum. Is it something they've built in-house, or is it outsourced? Are they using something like MedBridge? Um, Keeping in mind that you as a PT could just buy access for $200 a year to MedBridge. And so that's where I kind of start to consider, well, how much have they really built their own curriculum to complement their patient populations and really fine tune what they want their residents or fellows to be learning, versus is this more of just a generic program that I could be buying on my own and studying on my own. So I think there's kind of some interesting considerations there. Um, then you want to think about how is it maintained? Is it being updated by the fellows or residents that are going through that program? How often is it updated? Really and I think a really key consideration is the learning style. Is it using kind of more of an online format? Is it just journal articles? Is it recorded presentations such as this one? What additional resources, this is a big one, do they have affiliated with their program, like grand rounds, other residency fellowship programs where you'll be interacting with those residents and fellows, cadaver labs, and anything else in terms of maybe continuing education programs that are coming through their program. For the mentors, this one's a big one to me. Who are they going to be? What are their qualifications and years of experience in mentoring, as well as in the profession? How stable are those mentors and what kind of training do they receive? How many mentors are you going to have throughout the curriculum? Typically, you're going to have 2 to 3 throughout these programs, but there's a lot of variability there. And how do they match that mentor to the resident or fellow? We all have different learning styles and different teaching styles, and really ideally your mentor be someone who really meshes really well with your own individual learning style. And then how are those experiences being evaluated and refined over time? Those are kind of key questions you want to be thinking about and asking the program director about. Other considerations are application cycles, such as the timing. Maybe you're graduating in December from your physical therapy program, and this residency program that you're interested in attending doesn't start until August, as application cycles are heavily varied depending upon program. And so that might be a key consideration for you, because you might have to put working on hold for quite some time in order to participate in a program, and that may or may not be realistic for you at this time. Size of the program, this comes down to learning styles. The smallest program is 1, and then some of these programs, especially the hybrid onlines, can get to well over 100 individuals going through the program. And so you have to think about your own learning style and the size of the cohort that you'd like to be going through with. What are the reputation outcomes of the program? So newer programs, that's where you might be a little bit more concerned about the overall quality of the experience of that program. And so that might be a key consideration for you. Patient population, especially maybe in areas like sports, where if your career goal is I want to work with Division I athletes, it would make sense that your sports residency was housed within a D1 school or had access to those athletes at a high level in their patient population. So like such as Duke University Sports Residencies program. That would be in contrast to Vail's sports residency program, where you might see quite a few more mountain athletes. You would still see some D1, but it's definitely not going to be the same type of experience. You have to think about if the residency really matches your overall career goals. Time and travel requirements. So you are going to be working above and beyond what you would be as a normal clinical physical therapist. And I say typically, I mean, there's obviously some PTs who work very, very hard and doing a lot outside of work. But typically you're going to be doing a little bit more than you would be just as a full-time clinician. And then some, like sports, you're going to have travel requirements and other things, and you might be working quite a bit, especially in season. And then final thing to consider is their current stage of accreditation. Some programs might be in candidate status, and that means that you would be the first cohort going through that program, and that program could or potentially not receive accreditation, and then so you would potentially not graduate from an accredited program. So you have to decide if that's a risk you're willing to take to be one of the first people through, as well as when is the program up for reaccreditation. Programs do lose their accredited status, and so if that accreditation process is going to occur while you're a student within that program, that's just something for you to consider that does carry a little bit of risk. So probably one of the biggest considerations is competition, to be honest. There are a lot of PTs coming into the market. I know Jen already talked about this earlier in this presentation. Here in 2015, we have over 8,000 new grads coming into the job market. These are by far and away your largest applicants to residency programs. As I mentioned, they're not eligible to apply for fellowship programs, so fellowship programs don't have as much competition associated with them. But I would say residencies are highly competitive. And so we're going to talk a little bit about how to increase your competitiveness for these programs. So just how competitive are programs? It's a little tough to say. Based upon data in 2013, we know that a total of 540 individuals were accepted from about 1,400 applicants for all residency and fellowship programs. And so that's about a 38% acceptance rate overall, which you might look and say, well, hey, that's not actually too bad. However, I would say that some programs are way more competitive. For example, in speaking with the Duke University Orthopedic Physical Therapy Program Director, they take 2 individuals per year. Their acceptance rate is well below 5%. And I know this past year they only took 2 individuals who are already working at the university, and such that so anyone who applied didn't get into the program that year. And so some of these programs can be very, very competitive to get into. So how do I increase my competitive edge if I'm interested in getting into one of these residency programs? Well, first and foremost, be passionate. I mean, when you're interacting with directors, interviewing, just in general, like writing your essays for your application, it needs to be really clear that you are really excited and this is the right fit for you and you just want to do this with all your heart and soul. And I think that really comes across as being one of the most impactful, especially to a lot of the residency directors I talk to, in terms of they're really looking for someone who this is what they want to do, and that needs to be really obvious. Then just kind of some other tips. First I'd say do your homework on the program. It was interesting to see as a fellowship director how many people I had who'd call me up with questions that would very easily found on our website, and that automatically kind of sets up this impression in my mind of you as an individual of someone who's not really a self-directed learner, and that's something that I look for, and I know numerous residency directors look for in their applicants. And so I would say use that time if you're going to call and talk to the director to really talk to them about specifics of their program that are not found on their websites that really delineate that from other programs, as well as how well their program matches your overall career goals. And so what's that kind of match between you and the program? I think that's the way you want to spend your time talking with directors to really make a solid impression, as well as to really make a solid impression. You also want to talk to past graduates of the program. I think that's probably the best example of really the quality of the product that program is going to create. And so I think they're excellent resources, and oftentimes directors will be more than happy to give you residents of current and past graduates of the program. And I do recommend reaching out to those individuals. You are going to need at least a few letters of recommendation during your application process. And so you want to have solid recommendations within that specialty or subspecialty area. So cultivate those relationships on your internships or during your career so that you have that support going into your application process. I highly recommend meeting the director of the program. Some directors allow this, some don't. I do know that there is a great opportunity at APTA's CSM. They have a residency and fellowship meet and greet on one of the evenings. That's where all the residency and fellowship directors are. I will say that it is a little bit of a madhouse in terms of an event because there's about 1,000 people in the room, and there are numerous individuals all wanting to talk to the same director at the same time, especially in the residency areas. And so it's not the ideal environment, but it is a way to get some face time with a few different directors from a few different programs if you're trying to start to narrow down your choices. I definitely recommend, once you've narrowed your list, though, to travel and visit the program to really see if it's a good fit for you, because you're going to be committing a year plus to this organization. So you want to see if this is really a good fit for you, as well as traveling there gives you a really good idea of what that experience is going to be like. If you're currently in school and viewing this presentation, you really want to excel in your education. Or if you're a practicing physical therapist, you want to look for great continuing education opportunities that really build your resume within that specialty or subspecialty area. You want to show you're ready for the program. Um, that comment comes from the fact that numerous of these organizations will have an in-person interview process where you're going to be required to demonstrate your clinical skills. And so you really want to master the basics that you learned in your entry-level physical therapy program, as well as show that you're really willing, you want feedback, and you seek out criticism, and you're really anxious to grow and learn in your skills, as well as have really good, solid clinical reasoning skills. And then finally, the back doorway in is working for the organization. I know numerous individuals that apply to residency programs, they do not get in because they're so competitive, but then they get a job within that organization, and then they reapply in the next cycle, and then lo and behold, they get into the program because they've had a year to work with that organization to get to know all the key players and to really make a strong impression. And so that's that can be a very excellent way if you really, really want to get into a program in terms of increasing your ability to succeed. So just some quick nuts and bolts of how to apply to programs. So many use the residency fellowship PTCAS system, but not all, as this is a newer system and some programs that were in existence are grandfathered out of having to use this system for their application process. So you really want to learn about that program, about what is their application process, because not all use it, as well as the timing varies heavily. Other key things to highlight, you will need letters of recommendations, and I recommended those being very strong in that area of specialty or subspecialty. Essay questions demonstrating your passion and why, why residency or why fellowship training, and being able to answer that question very solidly. And then also to be aware of, some programs, not all, have an interview component, which can be in-person or distance-based. The in-person ones, often I've seen incorporations of assessment of clinical skills. So be prepared and ask ahead of time what is involved in the interview process so you come in well prepared for what's going to be required of you. Here's some resources for your information. So the complete program directory of accredited residencies and fellowship programs can be found on the ABPTRFE website. So that's the American Board of Physical Therapy Residency and Fellowship Education. As well as the application for most programs is going to be through RFPTCAS, and here's the link for that for your information. Here are the references I cited today in case you're interested in learning a little bit more about these articles and the information contained within. And then in summary, we just wanted to end with a slide that really summarizes the differences between residency and fellowship training and PhD training. Dr. Stevens-Lapsley and I have spent a lot of time here today talking about the differences and why you might want to be doing these programs, what to consider. And so here's an overall in detail summary slide. I know she had a very basic kind of big picture one, really summarizing the intent, what's your goal? Or is it really clinical mastery? Then you might be leaning towards residency and fellowship training. Are you more interested in academics and research? Then PhD might be the best path for you. But there's numerous other aspects, how these really differ in terms of the commitments and kind of other considerations. And so I hope you find this slide useful and maybe thinking about your overall career goals and where you see yourself going, not only in the short term, but in the long term. And we hope you enjoyed this presentation.